I'm Dr. Natalie Marks, and we're here with another quick cup of knowledge. Today, I have Erin Spencer joining me. She's a licensed veterinary technician with a specialty in emergency medicine, and also the current president of NAVTA. Erin, thanks so much for being here.
Thanks for having me.
Absolutely. You know, being the president of NAVTA, you've got a huge role right now, and I think one of the big things you're trying to convey to the technicians in that space is how organized medicine and involvement in that can really keep them engaged and help with their well-being. Can you speak a little bit to that?
Sure. I think one of the most common things I hear is someone in whatever organization they're in says, I really don't like what they did in this instance, and so I'm going to move away from that organization. Mm-hmm. And for me, I'm the opposite. If I see my group is doing something I don't like, I'm going to get more involved so I have a voice. And I think a lot of our technicians feel they don't have a voice in their own profession right now. And being involved in those organizations can help that. And so when I meet somebody that says, I'm not really happy with how things are going, my first answer is get involved. Whoever you think is doing it wrong, go be part of them, because you can help change that. And I think beyond that, if you're not ready to be that involved in an organization in some way, just being part of a state association or a national organization or some kind of specialized organization, when you get a newsletter that has an article that speaks to you, you suddenly realize they put this in a newsletter that went out to hundreds or thousands of people. I'm not alone, whatever that thing is. So even if you're not ready to fully get out there and have your voice heard, you at least can start to feel part of something. And there's very few of us that are true loners, even though we try to be. So I think really seeing that you fit into this group is just in and of itself helpful to well-being.
Yeah, and I think a lot of our profession, we're introverts, right? But we all need community. So I think that's such a valid point. And I think also, as we were talking, a lot of veterinary technicians today feel underutilized in their practices, right? And this is a way also to empower them. But what would you encourage some of those technicians who are feeling sort of stifled or plateaued? What would you encourage them to say to their management teams about the roles they want to play in the practice?
I think there's the first thing that I've heard, having a lot of conversations as the NAVTA president and president-elect prior to that, is what we're finding is that a lot of practitioners don't know what a veterinary technician went through in school. They don't actually know what our curriculum looks like, and so they struggle with how to utilize their technician. They learned how to put a catheter in veterinary school, so they think they're the one that's supposed to put a catheter in, and they don't realize that we probably got even more training on how to do that. And so I think the first one, which sometimes is hard for us introverts, I'm one of them, is to actually show your value. You know, if we aren't out there talking about, well, I can do that, and I was trained to do that, then no one's going to know we can. So I think that's a huge piece, is getting out there. And then where, kind of tying back into the organized medicine, if you have that community, if you are someone that isn't quite sure how to do that, asking out to the group. So how do I get them to listen to me? What should I be saying? And I think that's a huge piece right off the bat, is showing your worth and speaking up to educate your managers or your veterinarians on what you can do.
Yeah, and we also talked a little bit about how that would help emotional well-being, right? So compassion fatigue is an issue that's very hot topic right now, right? Across the entire space, the entire profession. And a lot of it is being directed towards the veterinarian, but the veterinary technicians and assistants in the practices are feeling that just as much, maybe sometimes even more. So what would you suggest to some of the techs that are feeling this in practice? And are there resources to reach out, or what can they do to help each other in the practice themselves?
Yeah, I think there's a couple of things in there, so I'll kind of address them a little bit chunked out. So I think as far as the combating compassion fatigue and resources for that, I think they're out there coming to conferences like these. There's talks about that, and that gets you some tools. I was just recently at a talk where someone was kind of not about if you're in a position of feeling compassion fatigue, but how to be there for other people. And I think those are the conversations we need to be having. So looking into coming to conferences or going to continuing education, it's out there for that right now, which is fantastic that we have that. I also think from a not so much compassion fatigue, but burnout. Those are, maybe kind of together, maybe separate. job satisfaction and having that can help prevent some of that burnout. I think a lot of, especially on the technician end of things, is you hit this wall and then say, well, I've got nowhere else to go, and is this really my life? Is this all I'm going to do? And there are a lot of avenues to pursue out there. They're just not all obvious. And so again, going back to that community and being part of those organizations opens those doors. I did not get to be president of NAVTA by staying in my practice and not talking to anybody. It was networking, it was meeting new people, it was getting new opportunities. But I also think to kind of talk more about that job satisfaction piece and what are those resources looking like, and how do we help each other is really the key. And the bottom line for me is we need to be kind to each other and be supportive. I use two examples or two avenues for that when I teach my students, and that's give people the benefit of the doubt and try to put yourself in their shoes. And right off the bat, if we're doing that in practice with each other, we're going to help be more supportive. I think compassion fatigue, unfortunately, doesn't just come because clients are putting us in that position, whether the clients are mean or clients are making decisions that we don't agree with. It's also sadly right now coming from each other. And I think if we can just give each other the benefit of the doubt, learn that how we perceive the world and how we make judgment calls may not be what that person is doing, and try and put ourselves in their shoes, right then and there we're going to have a better environment that we can support each other through these things, and hopefully then be recognizing when our coworkers are truly in trouble.
It's very well said.
Thank you.
Very well said. Shifting gears a little bit, I want to talk a little bit more about NAVTA this year.
Sure.
So what's on the docket and what are some of the goals of the organization?
So NAVTA went through a huge transition year last year, and somewhat cliche to say this, but totally true, that sometimes a big shakeup like that is a huge opportunity. And luckily we had a group in place that's exactly what we looked at. It was a rough year, but we looked at it from the perspective of this could be great for us. Let's use this as an opportunity. So we, at the end of 2018, signed with the AVMA for association management. And just to be clear, that does not mean we are now part of AVMA. That's been a common misconception. Sure. But they're just any other association management group. They'll provide resources for us, but we're in the process right now of hiring a new executive director. And so I think our focus for this year, during kind of my year of being president, is get that all in place and get the structure back. We looked over the last year to kind of that opportunity to see where were gaps and whatnot. And we filled a lot of them in, and now we're ready to grow. So once that executive director gets in place, the goal is really just push forward. We really want to increase membership, so there'll probably be a membership drive. Continuing on with the big topic of utilization, as we've talked about, kind of there's a lot of different pieces in that, and having conversations with our members, having conversations with other stakeholders about how we continue to improve technician utilization. And then also what do our members want, what can we bring our members? So kind of looking a little bit more at those things in the coming year.
Well, change can be hard, but change can be very good.
Yes.
So it certainly sounds like we're on a good climb here, and it's going to be some very exciting opportunities ahead for the group.
Yes, we're calling it NAVTA 2.0, and we're
awesome.
ready. We're ready to make it, kind of take it and run with it. So it's exciting.
That is exciting. And so for techs that are listening, so either technician students or techs out in the field who are listening that want to get involved with NAVTA, what's the first step?
First step is become a member. If you are a credentialed veterinary technician, and you can have full membership with voting rights and ability to run for board and be on committees and all that stuff. We do also have associate memberships, and we also have student memberships, and there's different levels of that. So NAVTA.net's the website, and there's a link to go to membership. And if there's a question on where you fit in and what your category would be, certainly there's info at NAVTA.net, and we can answer those questions. But that's the first step, is becoming a member.
Well, first steps are always good, right? Baby steps are helpful.
Exactly. Yeah.
Well, NAVTA is very, very lucky to have you at the helm this year. And we're really excited to watch the growth and development of the organization. And I want to thank you for joining us today and wish you the best of luck at this conference.
Thank you.